Hello. Today I will be talking about the crisis of the abundance of online consumer health information and how health literacy skills relate to health management. Nurse practitioners play an important role in health literacy education, and this presentation discusses that role. Health literacy education is becoming more important due to the ever increasing availability of unregulated health information that is found online. Online consumer health information is defined as health and disease information that's created for and directed to the general public. Health information found online has become dramatically more popular and more accessible over the past 10 years. The internet, which is the most popular source, provides fast and free access to unlimited amounts of health information for any desired topic. And this increased utilization of unverified, unregulated, and possibly incorrect health information can have negative effects on patient outcomes. And for this reason, patients require general education for or on the interpretation of health information available to them online, and they do require some sort of basic health literacy skill. Providing patients with adequate knowledge and reviewing online consumer health information for accuracy and trustworthiness is the only way to ensure that patients do not follow unregulated health advice. Healthcare providers, including nurse practitioners and especially primary care nurse practitioners, should be responsible in ensuring this education is provided because adequate health literacy skills has been proven to correlate with greater patient outcomes. The purpose of this project and this presentation was to review the importance of online consumer health information education and discuss the nurse practitioner's role in this process. Considering that patient education is one of the many roles held by the nurse practitioner in healthcare, online consumer health information education must be one of the key topics of discussion for most and pretty much all patient populations. This project assessed any correlation between health literacy levels and patient health outcomes, and that includes disease management and medication adherence. Because studies have proven that patients with adequate health literacy skills have better control of chronic diseases and they manage their overall health better. They're more self efficient in their care and they're more involved in discussing care management plans with their care provider. This project evaluated the problems that are associated with low health literacy skills, and it acknowledged that this unknown crisis of online consumer health information's effect on unknowing and undereducated patient populations. The role of the family nurse practitioner is multidisciplinary, and this topic is applicable to nursing practice because of the nurse practitioner's role in patient education. They not only collaborate with patients to determine care management and specific treatment plans, but they also have such a strong role in patient education. Considering the increased usage of online consumer health information and the role the nurse practitioner plays in education, they can essentially help prevent the negative outcomes that may result from health information that's obtained through the internet. The primary care nurse practitioner can provide accurate online health information evaluation tools and they can educate patients on the dangerous things that can happen by misinterpreted information found online. Primary care nurse practitioners must also be equipped with the knowledge that's required to educate their patients on proper health literacy skills, and they need to be knowledgeable and know that their patients are going to come to them with things that they found online that is possibly incorrect, and they need to change their viewing and correct them in things that they found that are wrong. So upon graduation, I personally plan to pursue a career in family or primary care medicine. In the United States, the primary care health professionals are in high demand, and this is causing a shortage in available primary care physicians to so many patient populations. And in order to fill this ever increasing demand, nurse practitioners are being called to primary care positions all throughout the country. A major role, like I said before, of the primary nurse the primary care nurse practitioner is to educate patients on proper usage of online consumer health information. Because, as mentioned, one of the negative effects of online consumer health information is its ability to influence patients to alter their care management plans. Research has also shown that patients utilize advice or treatment found online rather than seeking professional treatment from their primary care provider. And so, after completing this project, I now understand the importance of health literacy education and how unsafe all of this unregulated health information that's available online is to undereducated patient populations. So, this nursing issue of online consumer health information. So, online consumer health information is available to mostly all patient populations. The most popular sources, the internet, others being government websites, public organization websites, blogs, and social media. There's so many other places. Health interventions are the most commonly researched topic, but like medication instructions and treatment plans, stuff like that, are other highly researched topics. There was a study conducted on health literacy in diabetic type 2 patients, and it found that 45% of their participants sought healthcare information from their primary care providers, while 30% utilized mass media and 25 utilized the internet. So that's a total of 55% of patients who utilized other medias other than their primary care to help them manage their diabetes. This research also found that 60% of participants believed that the internet was convenient and an important health information platform because of its accessibility. These statistics just only prove further that we are in this, I guess you can say, online consumer health information crisis, and that health literacy education is a must by primary care providers. Regardless of how this online consumer health information is obtained, it remains unregulated and unverified. And for this reason, it is highly dangerous to those who utilize it incorrectly. Patients are now required to be equipped with basic health literacy skills, and they need to have the ability to interpret health information provided to them. Health literacy is defined as the ability to search for and understand health information from an electronic source and then apply that acquired knowledge to resolve a health problem. The Center for Disease Control, or CDC, reports that 90% of adults in the United States lack appropriate health literacy skills and do not understand how to properly interpret medical information available to them. And that is so dangerous and very scary for them. Considering that high percentage of Americans that do struggle with the interpretation of health information, we can, like I've mentioned before, consider this a crisis and a major patient safety concern. As mentioned, low health literacy correlates with so many negative patient outcomes. They put delays in seeking primary care providers. They don't adhere to their care management plans. They have poor overall health behaviors, which then increases their risk of developing chronic diseases. It also has a negative effect on the patient provider relationship, which is an important relationship to develop. Patients with low health literacy skills are less likely to be involved in their care and participate with their provider in developing an appropriate care management plan for them. Um, those patient populations that have low health literacy skills are associated with increased hospital risks and lower preventative care rates, and they have a poor, like I said before, have a poor ability to understand and adhere to medication instructions. Many of these populations are affected by the negative outcomes of low health literacy, and those most common populations include ethnic and racial minorities, older adults being such a great percentage of our population these days, populations with limited financial and educational resources, and people who don't speak English as their primary language. But low health literacy is not specific to these populations. Anybody may be challenged by the difficult health language that we speak so well. The general public should be knowledgeable in basic medical lingo, and they need to know how to navigate the health information that they can find online. The primary care nurse practitioner should be responsible for educating their patients on evaluation techniques of online consumer health information. They should never assume that patients understand any provided information to them. They should thoroughly assess for proper interpretation and make sure patients totally understand what it is they're saying and what it is they're recommending. The usage of online consumer health information has been rapidly increasing over the recent years, along with that mentioned percentage of Americans who do not know how to properly interpret medical information. The crisis here is that the poorly performed health searches have been proven to influence patient care behaviors and their health management. This false and or possibly incorrect online consumer health information results in inappropriate health interventions that are ineffective and potentially harmful. It also has been shown that health information found on the internet influences patients to seek unnecessary treatment for health issues and delay seeking care for things that they actually need interventions on. Online consumer health information education is essential due to the increased usage that we're seeing and the inaccurate results that it bears. Because any person has the capability of publishing health information on the internet through websites, blogs, and social media. And as I mentioned, those are some of the most popular sources. Patient populations are utilizing this increasing amount of health information available to them, and they're not equipped with the skills required for evaluating them for accuracy and trustworthiness. And the primary care nurse practitioner must find a way to make that happen. So the conceptual framework that fits best with this project is the healthcare belief model. This model is a psychological model, actually, that's framework is utilized to prevent health behaviors. This model describes individuals' perceived threat to disease and how that threat influences their healthcare beliefs and their health decisions. Increased health literacy skills correlates with increased involvement in care and overall autonomy in healthcare. A study was conducted that found a relationship between advertisements and healthcare behaviors utilizing this healthcare belief model. This research concluded that being exposed to online consumer health information had the possibility of changing individual health behaviors. So these findings prove the need for consistent health literacy education, and that needs to be provided by primary care nurse practitioners in order to ensure that health behaviors are not being drastically changed by unverified information found online and information that's provided to them by a simple advertisement. So there's a lot of areas for future research on this topic. I feel like this is a growing demand, but some of the things we can mention, further research can be utilized to create a detailed online health information evaluation tool that can be well understood by all patient populations. Data can be collected on specific educational techniques that will be successful in providing basic health literacy skills and online information evaluation. This health information evaluation tool can be equipped with specific tips on judging reliability of health information found online. And in doing so, patient populations will have the basic knowledge required for the vast amounts of unverified and untrustworthy health information that's found on the internet. Qualitative research techniques can be utilized to create this tool. It would be accessible to all patient populations who utilize the internet for health information. It will be easy to follow with simple guidelines in determining accuracy and reliability of the information that they find. Because as previously mentioned, the internet is such a high traffic area for health searches. Um, 60% of Americans find that the internet is a useful tool and they feel that it makes them self-efficient in their care management. So this tool, I think, will have a great impact on health literacy, and it could hopefully help decrease the amount of harmful or incorrect health interventions that people are performing that they find on the internet. A quantitative investigation that would further benefit the work of this research project would be a detailed comparison of health literacy and chronic disease management. I know we mentioned a few before, but those with appropriate health literacy skills have been shown to have better health management of chronic diseases. They're also more autonomous in their care. These patients practice better health management behaviors and they adhere to medication regimens and care plans that they find together with their provider. The primary care nurse practitioner can assist in the management of multiple disease processes. So further research can be conducted comparing health literacy skills to specific chronic disease management. This research can be conducted through a long-term study with specific patient populations that share a common disease. Patients can be well educated on health literacy and be provided online health information evaluation tools during primary care visits and then utilize those over a period of time. Chronic disease self-management will then be evaluated by any progress made in combating or managing their disease process. Understanding quantitative results of increased health literacy can further prove the importance of health literacy education amongst all patient populations, which is what this project is trying to do. So the overall goal of this project was to research the correlation between health literacy skills and health management. The research conducted proved a significant relationship between health literacy and healthcare management. Adequate health literacy has been proven to increase patient involvement in their care and it has proven to make them more self-efficient in their care. It has also shown to increase patient outcomes and condition management. And then on the other side, low health literacy skills are linked to increased hospitalization stays and low preventative care rates. And, most importantly, poor medication and treatment plan adherence, which then can essentially be fatal. So as mentioned throughout this entire presentation, unverified health information available through the internet is greatly accessible to so many patient populations, and the majority of them have low health literacy skills. And this information has such a strong impact on those who are not properly educated on its potential harmful effects. The health information can be easily accessed and perceived as valuable, which then has a high probability of changing healthcare behaviors. The increasing availability of unregulated health information that is found on the internet should be considered a huge patient safety issue. The outcome of this project proved that the primary care nurse practitioner must have the skills and resources available to educate patients on adequate health literacy techniques. The nurse practitioner should provide their patient populations with tools that will assist them in finding appropriate and reliable health information through the internet. So in doing so, patient autonomy and involvement in their care will increase, therefore improving patient outcomes and health behaviors. This project highlighted the importance of health literacy education because if this high percentage of Americans that are not equipped with appropriate health literacy skills does not increase, then we will be in an online consumer health information crisis, considering all of the dangerous effects that can come from misinterpreted information found online. It is our responsibility as studying nurse practitioners to ensure that this crisis is stopped before it started, for the vitality of our patients and the entire population. Thank you so much.